Next person is Aaditi ANILKUMAR. Can you just put the presentation, Aaditi ANILKUMAR?
Good morning, everyone. I'm Dr. Aaditi, and my paper is on impact of consanguinity in prevalence, severity, socioeconomic burden in Rett dystrophies. So consanguinity is a union between couples with a common ancestor. It is not an uncommon practice in India. The prevalence rate is up to 9.9%. Why is it socially favored? Because it may enforce couple stability. There are some hidden uncertainties in terms of health and financial issues, and it may strengthen family ties. So most of the retinal dystrophies are autosomal recessive, and consanguinity increases the disease burden of some of these diseases. So AIM, as I previously mentioned, this is a retrospective observational study of 5,108 patients between January 2016 and January 2025. A standard consent was obtained for data sharing, and also a short survey was done with 40 patients to understand socio-economic burden of the disease. They all underwent a comprehensive ophthalmic examination with pedigree chart, which was hand-drawn based on recall. They underwent relevant investigations and electrophysiological studies and genetic counseling and testing wherever possible. Moving on to results, so data retrieval and processing was based on an Excel sheet where data was segregated and processed. Total patients were 5,108. 39% of them were females, 61% were males, and the mean age was about 31.59. The dystrophies that we came across were these. So, at least 75% of them had at least one consanguineous marriage in the family, and about a whopping 20% had two consanguineous marriages in the family. And most of them were second degree consanguineous. And as far as generations of consanguinity is concerned, 81% had at least one generation, 17% had two, and about 2% had three generations of consanguinity. So individually looking at it, 47% in RP, 43% in Stargardt's, 25% in cone dystrophies, 53% in Conrod, Rod cone had 60, Leber's had 69, macula had 25%, and the rest of it, 66% of consanguinity out of the total numbers. So what is more alarming here is even with one affected member, about 10.2% still went on to marry consanguineously, and about 0.3% with three affected members went on to marry consanguineously. So let's look at this case of a 24-year-old newly married woman who is got decreased vision in the left eye compared to the right eye since childhood. She's already a diagnosed case of retinitis pigmentosa, and she was interested in family planning. So the vision is 6/9 and 6 in both the eyes, clinically classical RP picture, and the OCT also confirms the same with a subfoveal EZ preservation. This is the pedigree chart of the lady. She was born out of a consanguineous marriage and still went on to marry consanguineously. This is the genetic testing of the patient. She had a CNGB1 mutation. And when we looked at her brother and husband, both of them also had defective genes. So we counseled her for the same, about the same. There was a short survey looking at the impact of mental health, financial issues, negative social aspects, negative aspects on social life. And all of them had 55% turned out to have mental health issues. 72% of them told us that all these conditions are leading to financial issues also, and it also impacted their social life. So in spite of telling them about the hazards of this, only 10% agreed to undergo genetic counseling, and it is a huge emotional and psychological burden. The preferences of consanguineous marriages is primarily based on social and cultural factors. So what this study adds is, it shows the South Indian data on the impact of consanguinity in retinal dystrophies. There is a huge lack of awareness about genetic counseling, the inheritance patterns, and the impact it has on various levels. So these are my recommendations. Thank you.
Yeah, thank you.
Very nice presentation and very
Thank you,
vast study.
Thank you, ma'am.
But one thing is there, Have you looked for the risk factors also in these patients?
Of
Apart from the genetics or the consanguinity, any toxic or the food habits? Or
yeah, so the entire detailed history is taken, ma'am. So the consanguinity just forms, say, around the percentages I showed individually. The other subset of patients have different issues. And I mean, some are spontaneous, some are sporadic cases, all of that, yes.
And in all the patients you did the genetic
So those who agree to it, so it is such a deeply it is such deeply rooted in the social custom that it's very difficult to get them to counseling and then to genetic testing. So not many agree.
genetic testing is very, very costly.
Yeah,
So it is-
at yes. So at least to counsel them in terms of when they already know they have an affected member in the family. So it is always better to give them information regarding the same and what are the possible risks. At least that part can be done from our end, because some of these diseases are potentially blinding too. So our bit, whatever possible from our end, can be done. At least an awareness, so that these practices slowly die away or fade off
This
over time.
the patients included were all known case of RP, Stargardts like that. Or
So
general
they are referred to us. They are initially
No, in this
diagnosed by
study,
us.
yeah,
All entire.
And there
All 5,000 are dystrophies.
dystrophies.
All
So
dystrophies.
actually, this may be a under evaluation, like prevalence of diabetic retinopathy in non-diabetic. There is a big undiagnosed diabetes, or something like that. So the impact may be more.
In fact, more. So
Yeah.
we can say, based on the cases that we receive over the last 8 years.
Yes, yes.
Dr. Varnika Aditi Singh also can come and get ready. Varnika Aditi Singh.
So,
Dr. Subhadra,
I'm a-
so yeah. You can stay. You can stay.
Oh, I just wanted to, there's no question for her, but I just wanted to comment on the cost. So, because I am in the genetic field for many years, the cost has drastically come down. Currently, it is costing about 15,000 for the screening test. So, patients, if they undergo cesarean section, it costs 50,000. So, also there are organizations which are donating now, especially the patients are donating for others to undergo genetic testing, because they want a pool of patients to have that genetic test positive so that the treatments can come. Government of India also now, providing for rare diseases. So I think we should all look at those options and try to get the genetics done. It's not all that impossible, which was 10 years ago.
Yeah, absolutely.
No, in our
Everywhere,
place
everywhere.
also
Even in,
everywhere, and
in
it
our
is
place we
because
are
it's
doing.
not only for the eye. Now genetic testing is being done for so many diseases that the cost of genetics, everything has come down. And previously we didn't have genetic counselors. Now that is open to non-doctors, and so now we have a lot of genetic counselors also, trained people. So I think the field is rapidly expanding.
Ma'am, I
and now
want
it
to
is
ask
available.
just to know from you
Varnika,
that if some patient come of
Veronica,
retinitis pigmentosa comes, and then specific gene should be asked, or the whole counseling for retinitis
We leave it to the genetic counselor.
Okay.
We are not experts. What we explain to the
Think we
patient
are
is the
running
importance,
short of
and
time.
then the
Yeah.
genetic counselor decides what test to be done. That is very important. We should not tell what, because
Okay, which gene should be-
what post-test counseling also has to be done by them only.
Okay.
Thank you, madam.
We have sessions on this. People can attend.
Yeah. Thank you. So, Dr. Varnika Aditi Singh is ready. When the